Let's see how parasympathetic nervous system works. It starts as a nerve coming out of spinal cord, and they meet at nicotinicholinergic receptor to give you a postsynaptic neuron that hooks up to cardiac, smooth muscle, or gland of its choice. Both pre- and postganglionic nerves are cholinergic type of neurons, releasing acetylcholine. The preganglionic fibers originate from cranial nerve nuclei 3, 7, 9, and 10, as well as sacral segment of S2 to S5. Just a quick recap before we continue. When two neurons come together, it's called synapse. And that's where one end of neuron axon releases acetylcholine neurotransmitters that binds to receptor present on the surface of cell membrane of dendrite or cell membrane of the next neuron in the series. We also have sympathetic part of autonomic nervous system. This is the opposite system to the parasympathetic nervous system. They also work through the spine. They come off from thoracolumbar segments, and they meet at ganglia. The ganglia is nicotinicholinergic as well. From there onward, they proceed on the different targets. For example, the muscarinic cholinergic receptor in the sweat gland, the adrenergic receptor on the cardiac muscle, smooth muscle, gland cells, and nerve terminals. We also have dopaminergic receptor on renal vasculature smooth muscle. Ganglionic synapses respond to nicotine, so they are called nicotinicholinergic receptor. Effector synapses respond to muscarinic, noradrenaline, adrenaline, and dopamine. Now let's move on to the adrenal medulla. Adrenal medulla is sort of part of sympathetic system, but we are going to separate it out because it's important to know that there is a nerve that directly connects the spine to the adrenal medulla. And the adrenal medulla then releases epinephrine and norepinephrine. Preganglionic neuron of adrenal medulla originates from the thoracic segment. They have nicotinic receptor, and those nicotinic receptors themselves end up releasing adrenaline and noradrenaline into bloodstream. Finally, we have voluntary or somatic system. It comes out in all segments of spinal cord. Preganglionic fiber originate from brain and spinal cord. They have nicotinicholinergic receptor on the surface of the muscle, and the effectors are skeletal muscle.